Good morning and good afternoon. Welcome to the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. My name is Alandra Nelson. I'm a senior advisor with the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, and the designated federal official for the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. I'm delighted to welcome you here today to the second day of the Commission's inaugural meeting. Before we begin what will be another remarkable day, this is the Federal Advisory Committee that operates under the regulations of the Federal Advisory Committee Act. The Advisory Committee process ensures independent review in an open and public manner with opportunities for public participation. I'd like to share some operational guidelines that will make sure that all voices are heard. We need your cooperation in organizing communications to the Commission. For members of the public and those joining us via the live stream, we will not be having oral public comments at this first meeting, but we will be accepting written comments throughout the entire process. We want to ensure that the public has an opportunity to engage with us, and the process is transparent. You may submit written comments to Aaa and Hpi Commission at hhs.gov. These will be shared with the full Commission for their consideration. It is now my honor and privilege to introduce our first speaker, Lisa Pino. Lisa is the Director of the Office of Civil Rights at the U.S. Department of Health and Human Services with a long career in public service. Most recently, Dr. Pino served as the New York State Department of Health Executive Deputy Commissioner, a first-generation daughter of immigrants and first college graduate in her family. She began her career as a legal aid attorney in the Southwest, protecting the rights of migrant and farm workers. Director Pino, welcome.
Thank you, Emmeline. My name is Lisa Pino, and as Director of the Office for Civil Rights within the U.S. Department of Health and Human Services, I would like to extend a warm welcome on behalf of Secretary Javier Becerra to everyone who is joining us for day 2 of the inaugural meeting of the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. I want to first start by congratulating our newly sworn-in commissioners who represent the rich diversity and strength of the Aaa and NHPI community, and whose expertise will be an invaluable resource to HHS and the Biden-Harris administration. It is an honor for both the White House Initiative and President's Advisory Commission on Asian Americans, Native Hawaiians, Islanders to be housed here at HHS, where they were first created under the Clinton administration over 2 decades ago. Last summer, HHS Secretary Becerra tasked the Office for Civil Rights, or OCR, with housing both entities. And as the director of OCR, I am so proud to welcome this commission to the HHS family. With the rise in discrimination and bias against Aaa and NHPI communities over the past 2 years, we must use every tool available to make communities safer. And this includes the use of civil rights enforcement. That is exactly what the Office for Civil Rights aims to do through our work to enforce federal civil rights laws that protect Americans from discrimination. Housing this new initiative in OCR is a recognition of our agency's strength and leadership on so many critical issues, including language access, civil rights, and equity, issues that are integral to this administration's work to advance racial justice. Additionally, the inclusion of the Commission within HHS emphasizes the need for Aaa and NHPI community voices and partnerships to be included in our efforts to drive this change. We at HHS stand with Aaa and NHPI communities and look forward to working with this Commission to ensure that we take meaningful steps toward protecting and promoting the civil rights of Aaa and NHPI and all Americans. The outcomes of the Commission's deliberations today will help to provide insight into the issues and challenges faced by Aaa and NHPI communities and identify steps to address them. It is my hope that this inaugural meeting will help to lay a strong foundation for innovative and lasting efforts to create meaningful change for AA and NHPI communities across the country. Thank you. And now I would like to turn it back over to Emily.
Thank you so much, Director Pino, for your very meaningful remarks. Our next presenter is Crystal Kha'i, the Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, and also the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. Crystal?
Thank you, Emmeline, and thank you, Director Lisa Pino, for your inspiring remarks. The Office for Civil Rights is home to both the White House Initiative and President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, and we are so grateful for your tremendous leadership and support. Before we kick off what will be another jam-packed day, I want to wish a very happy birthday to two of our incredible commissioners, Louisa Blue, whose birthday is today, and Aijen Poo, who will be celebrating tomorrow. I know there are probably a million other things that you would rather be doing on your birthday than sitting through a 5-hour Zoom meeting, but we are grateful that you are both with us and wish you both a very happy birthday from our entire team. As we kick off day 2 of our inaugural commission meeting, I want to give a quick recap of yesterday's meeting. All of you made history yesterday by being sworn in by our Vice President, Kamala Harris, who is the first woman, first Asian American, and first Black Vice President in history. You heard remarks from our two amazing co-chairs, Secretary Javier Becerra and Ambassador Catherine Tai, as well as other senior administration officials like Ambassador Susan Rice. And our fearless Chief Commissioner, Sonal Shah, led us through several discussions on some of the immediate challenges impacting the Asian American, Native Hawaiian, and Pacific Islander community, including the need to address the health and economic impacts of the COVID-19 pandemic that have taken a devastating toll on our communities, to combating the alarming rise in anti-Asian hate, to examining the threats of climate change and its impact on our communities. Yesterday, you also learned more about the structure of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or what we call WIONP, including its federal interagency working group and regional network, and opportunities that you can work more closely with these entities. You've also heard from former commissioners who spanned 4 different presidential administrations dating back to the 1990s, who shared their insight and best practices on how to tackle the work ahead. And we ended with a great session in which you were able to brainstorm some of the different subcommittees you would like to form and topics you would like this commission to address in the months and years to come. As I mentioned to you yesterday, we all know that these are not issues we're going to be able to tackle in the course of just a few hours or even a few days. But throughout your tenure as commissioners, you will have the ability to take decisive and meaningful action on compiling recommendations to the president that will help to advance equity, justice, and opportunity for Asian American, Native Hawaiian, and Pacific Islander communities. We have another incredible lineup of speakers today who will be discussing some of the systemic issues impacting our community. And so without further delay, I would like to introduce our Chief Commissioner, Sonal Shah, to kick off today's proceedings. Sonal.
Thank you, Crystal, and happy birthday, Louisa and Aijen. So excited to be back here with everybody. Welcome to everybody that's joining us on the live cast, and also, of course, the commissioners. And thank you for taking so much time yesterday and the great questions, and really looking forward to today. So Crystal gave us a great recap, and what I'm going to do is go through just our charge for today. Next slide, please. Today, we have to secure our understanding of the federal infrastructure, so we'll talk a little bit more. We have some great speakers coming today. We're going to learn about the systemic challenges, and we're especially going to go deep on data disaggregation and language access, and then what the federal response has been and recommendations from subject matter experts. Next slide, please. So our goals for the meeting, we'll hear from our subject matter experts regarding the issues and challenges, and then for Aaa and Hpi populations. We want to understand how federal agencies are doing or to actively support and advance equity, justice, and opportunity for Aaa and Hpi communities. And most importantly, we need to start mapping out our work over the next 12 to 20 months. We'll have quite a bit of time today. We'll have the last hour of our time together to work on that and decide how we want to approach the 7 priority areas in our charge and chart the options for developing recommendations addressing these 7 priority areas. And commissioners, I just want to make sure that we keep, and because the 7 priority areas are written into the executive order, I want to make sure that, other things that we want to do, we should also see if we can link them to the priority areas and make sure that we can address the charge that we do have to. Of course, we can do more, but we should also do the charge that we have been given by the president to make sure we can deliver on that. So as we move forward, next slide. I think that's all of our slides, if I'm not wrong. Oh, a few more. Establish subcommittees. This is going to be the hard part. We have to do more work to develop recommendations for the full commission to consider. And as you know, these subcommittees, we can also serve on several subcommittees, but recognize that we're going to have to work pretty fast to get some recommendations. And these are rolling recommendations again, not one set of recommendations at the same time. We need to identify chairs and the commissioners for each of the subcommittees. And let's keep in mind that there's likely a chance that even within subcommittees, things may overlap and things may cross over. So we will manage to that. And also we can obviously sit in on each other's subcommittee conversations. And then we want to articulate issues for which we would like to receive additional research, information, presentations. We started this process yesterday. Thank you for all of the time that you all gave. We'll do more of it today, but to make sure that as we do our subcommittees, we can make sure that we are keeping track of everything that's happening, but also make sure whatever extra we need, we're putting it out there so we can also start reaching out to the different groups within the White House and across government to make sure we can get the briefings that we need. So again, this is a prerogative that we have and we should use. We heard from a lot of people yesterday, a lot of experts, and today we're going to hear from more. So keep that in mind. We do have to establish our subcommittees, identify the chairs and commissioners that will be on the subcommittees, and also identify what other issues that we would like to get more research on. So let's keep moving forward. I'm looking forward to a very fruitful day today. I know we're going to be busy and I know we're going to keep you long. We've got 2 days that have been busy. So let's, I'm going to go ahead and get started for our second day. So it is my pleasure to moderate this next panel where we are again looking at systemic issues impacting our communities. And it's about, largely it's about data disaggregation and language access. You will have time to ask questions. You will have time to hear from experts on the work that is being done, and both within government and also outside of government in this next panel. So I hope you will continue to ask the great questions that you have been asking. Our first panelist is Dr. Alandra Nelson. She is the co-chair of the White House Equitable Data Working Group. No better person for this conversation. And she's the inaugural Deputy Director for Science and Society, both in the White House and the Office of Science and Technology Policy. Dr. Nelson is also a Harold F. Linder Chair and Professor at the Institute for Advanced Study, an independent research center in Princeton, New Jersey. Please welcome Dr. Nelson. And Dr. Nelson, it's so great to have you here. Thank you for taking the time.
Thank you very much, Chief Commissioner Shah, for that introduction. And I'm delighted to be here on the special occasion of this inaugural meeting of the Aaa and Hpi President's Advisory Committee. So I'm going to talk a little bit about the work of the Equitable Data Working Group, which is so central to the Biden-Harris administration's equity agenda and also so central to advancing an equity agenda for many communities of color. Next slide, please. So just at a top line, just to remind you, although I'm sure you don't need a reminder, that one of the many historic things about this administration was a day one executive order advancing racial equity and support for underserved communities through the federal government. Equity and this executive order means the consistent, fair, just, and impartial treatment of all individuals, and notes in particular communities of color, rural communities, veterans communities, LGBTQ plus communities, and others. And notes, importantly, that a first step, and this is a quote, to promoting equity in government action is to gather data necessary to inform that effort. So this executive order on equity moves forward with an understanding that one needs to have a kind of baseline of understanding about what's going on in the world of federal programs and policies, as well as a baseline that helps us understand how we're doing, or how well we're doing, or how we could be doing better. The necessary data referred to here also includes disaggregated data that can help government, communities, and researchers to better understand specific demographic characteristics that both reflect and influence people's lived experience. Next slide. Thank you. In particular, the executive order stood up the Equitable Data Working Group, which is really a kind of first of its kind body devoted to issues of equity in data, and gave us our charge, which was to consult with agencies about existing federal data, to recommend strategies for addressing deficiencies, and to support ultimately agencies and their action plans to measure equity and capture the diversity of the American people. Next slide, please. So we had there's some clear challenges for equitable data. And I know, I've learned a lot of this from my colleague, Karthik, who's on the line, so I'm sure we'll have much more to say. But it's one thing to have data. It's another thing to have the data that you need to answer questions about equity, to make equity assessments, and to be able to ask questions about communities that have not been always fully seen in the sort of data landscape of the federal government. We know, of course, that federal data are often not available in a disaggregated form, disaggregated by race, ethnicity, sexual orientation and gender identity, disability, income, region, veteran status, and other demographic variables. But we found early on in the work of the working group that there were several categories. So it's not just we don't have the data. There were some particular kind of nuances to the ways in which we didn't have the data. So in some instances, data was underutilized. So it might exist somewhere. People don't, or people, and maybe it's not well known, or there are barriers to using the data that are organizational culture. They could be statutory. There could be the spectrum from how people have done things in the past and how that shapes how they imagine how they can use data in the future, to actual kinds of statutes and regulations that put possible constraints on the use of data. Sometimes data isn't accessible, so it can be used. The sort of data landscape often has been constituted with a few kinds of agency statisticians and sometimes a few handful of academic researchers in mind. But it's clear from the engagement that we've done that government has a responsibility to share in a privacy-preserving manner to the best it can through visualizations and dashboards and other things, data to the American public variously. And so there's also accessibility issues with regard to data based on different legitimate user communities. And then there's missing data that doesn't exist at all. Either it's very low in quality, or we just don't have the data because no one's ever asked. So those are some of the challenges that we face with regards to equitable data in particular. Next slide, please. So we've tried to move forward with how to think about, to begin to think about how we would address these kinds of challenges and barriers. And part of the work of the Equitable Data Working Group will be to sort of accomplish a vision for what equitable data might be and what it could do. And so one vision could be to characterize the experiences of groups that are currently concealed in the data. And this is obviously a significant problem for parts of the Aaa and Hpi community. Conduct equity assessments about government benefits and services. Are these services and benefits reaching the communities who need them most? Who are they reaching? How are they reaching them? And to provide a range of communities with access to equitable data and formats that are useful to them, as I intimated before. Principles of equitable data will also require that members of the public, of course, not be harmed or made increasingly vulnerable by the use of data analytics or data sharing. And also that the data is intersectional, that we have enough demographic variables at the scale needed and at the detail needed. So the kind of intersection between the granular and the large scale, both for for having detail and having statistical robustness, is one of the sort of challenges, and also one of the great benefits of equitable data, as we work to really accomplish it in government. Next slide, please. So we've been going, we started meeting, I think our first meeting was the March 29th. We met for the first time at the end of March of last year. And our approach has been multifaceted, and I'm just going to talk you through briefly what we've done. And it's included agency and department consultation, a significant public engagement, a review of some of the relevant work, and a case study approach. Next slide, please. So part of the equity executive order required actually that we do assessment plans. And so these assessment plans were required agencies and departments to spend 200 days looking across their programs and policies for whether or not there had been, whether there are, and to what extent there are systematic barriers and the ability for underserved communities to access services and benefits. And part of this tasking of the agency assessment plans was a question about data. And there were questions about data-related challenges, barriers with regards to getting data for equity assessment. And so part of our consultation was getting feedback from agencies about the data barriers that they're seeing in their work. Also within the interagency, there are sort of interagency councils, and we spent lots of time in discussion with bodies such as the Chief Data Officers Council, the Interagency Council on Statistical Policy, and the Evaluation Officers Council to sort of learn, these are the folks who know data structures, who know where data is or where data is not, who are, working in the day-to-day with the barriers and challenges on the ground. And then lastly, we worked and continue to work in consultation and collaboration with other executive office of the president working groups. So there was an executive order on diversity, equity, inclusion, and accessibility in government that, gave us some guidance around how we should be thinking about equitable data issues. Of course, the General Gender Policy Council released a few months ago their national strategy for advancing gender equity. And part of that strategy included issues and attention to being able to access intersectional data for equity assessment. And of course, as you'll hear from my colleague, Kimberlyn Leary, we work very closely with the Domestic Policy Council, who's our partner in this work and who really is driving forward the equity agenda in the Biden-Harris administration. Next slide, please. Our process has also included public engagement, including with many of you present on the advisory committee, and I'm sure watching online, including a wide range of Aaa and Hpi community organizations, research organizations, nonprofits, and the like. And we did this, we continue to do this, but we did this fairly regularly. We had what we called office hours. And so we all committed on the working group to set aside time every week to have this public engagement. It is a crucial part of our work. So thank you for those who took the time to engage with us in this process. Next slide, please. And then we were mindful of relevant work. This executive order in January of 2021 was not the first to point out the sort of disaggregated data challenge that faces us. And there had been important work. Some of you were involved in some of this important work in the Obama-Biden administration, including a 2016 report, white paper on best practices for federal data and disaggregation of federal data for Asian Americans and Pacific Islanders. Which is just to say and plant a flag that, we have learned a lot from work that has come before us, and we didn't have to and certainly didn't think we needed to start from the very beginning. So very much a part of our process has been drawing together and learning from these existing work that include, great recommendations and help us to think about on the government statistical side, how we get to statistical robust estimates that are, for small samples often that also protect confidentiality. And that really has been our guardrails and our sort of North Stars as we think about this work. Next slide. And then we did we've been carrying out a case studies approach. So I think one of the things that makes equitable data, a vision for equitable data, a little bit different is that clearly, state and local and federal governments, face all sorts of challenges with regards to data as we become a more data-centric society and as we understand how important data is for really understanding the world around us in new and different ways. But it's also the case that kind of solving the big data problem doesn't necessarily solve the equitable data or the disaggregated data problem. And so we proceeded with a few case studies led by folks in the working group, working with colleagues across the interagency, offering opportunities for sometimes agencies that hadn't worked together to think together about important priority equity questions for this administration and what data, what relationships, what networks we would need, networks across agencies to answer them. And so we stood up a few different case studies groups, and this I don't have answers for you because this work is still ongoing, but it has allowed us already to identify, areas of friction where we need to get to move forward, to have breakthroughs with regards to, MOUs between agencies around data sharing, cultural practices in organizations that have just never worked together before and the like. These case studies were stood up around questions with regards to disparities and inequities by race, ethnicity, SOGI, disability, income, and other variables with regards to participation or not in economic stimulus programs, and an understanding that opting out actually tells us something about equity. Why are people, not choosing to participate? Broadband access in rural areas, disaster relief and assistance, unemployment insurance, and COVID-19 outcomes. And again, this work is ongoing, so I don't come here to offer any answers yet, but to let you know that work is underway to really be able to drill down on these important priority questions for equity. Next slide, please. So as I said, the case studies examine specific questions and challenges. What we've seen that through the work that we've done so far is that, this work can inform our broader recommendations because they point to very kind of specific challenges and barriers that are occurring across government and that we hope can be incorporated into longer term agency policies and practices. Ultimately, we hope to be able to use these case study models and the relationships that have been built, the working relationships and the process of standing them up to facilitate institutional change. And lastly, the case studies have really been to demonstrate proof of concept. If we had the data, how could we use it to answer these really important questions, important for equity assessment, important for, ensuring trust in the work of government, and really important for underserved communities as well. Next slide. We can move forward. Thank you. I've said that. Thanks. Next slide. So a few kind of high-level lessons learned. One is that it really matters to have presidential prioritization. That the president really, on day one, saying that this is important, has really galvanized the interagency and has helped to really drive and galvanize our work. So the commitment of this president and vice president to this work has been really central, I think, to helping us move forward and giving people the motivation and the inspiration in the interagency to sort of move forward to try to solve some of these challenges and to figure out solutions to some of the barriers we face to disaggregated equitable data. We continue to work together with community experts and the non-federal research community as part of the work, and we know that this is really important because, as I said at the beginning, that federal disaggregated data is not just for federal statistical agencies. And so, hearing use cases, communities' aspirations for the data, academic researchers' aspirations of the data, there are lots of different sort of demands there, but we're very much learning that, how to think about those together and not prioritizing, for example, the academic research community as the community that should be addressed with regards to equitable data issues. And some of our data infrastructures have been set up with that community in mind. And then, of course, it's going to be tremendously important to support and incent kind of collaboration between all levels of government. So federally between agencies and departments, which we've been accomplishing in the case studies, but also with state and local jurisdictions. A lot of the challenges we face with data is because it sits in a kind of patchwork between different types of jurisdictions. And so building those relationships and partnerships is one of the big takeaways so far. Next slide, please. So the work continues. We are drafting some initial recommendations to Ambassador Susan Rice. The case studies, as I said, the work continues there. And out of the case studies, we've also spun up a few kind of sort of special projects. One around beginning to build a catalog of currently available disaggregated Aaa and Hpi data, building in part off of the 2016 work that started in the Obama administration. There's an ongoing work on improving demographic variables for the collection of SOGI data on benefit forms. There's a group of colleagues working together who call themselves the Rural Data Collaborative has been stood up to, similar to some Aaa and Hpi communities, rural communities, and those things often intersect, face challenges of small sample sizes, both how to preserve people's privacy, and also how to sort of get to statistical robustness. And so this Rural Data Collaborative is really trying to drill down on some of those problems. And then lastly, there's a group that is working on mapping and assessing equitable access to services in flood-prone areas, obviously a very important issue as climate change continues to happen all around us. So next slide, and I think that's the last one. Yeah, so thank you very much. It's been an honor to be able to tell you a little bit about our work, and I hope that you will stay tuned as we are able to say more about the recommendations that we will make to Ambassador Rice in the weeks to come. And over to you, Commissioner Shah.
Dr. Nelson, thank you so much for this presentation. And I just want to echo what Ajahn Poo just put in our chat, which basically says that this is a really big deal that the government is doing this. The federal government is leading this effort. Having worked in 2 administrations, I will tell you that we've talked about it, but what you all are implementing is pretty incredible. And this has a very long-lasting impact as the work you're doing is not just about collecting information and the research so you know what's happening, but that you actually have a plan for implementation. So thank you for the work that you're doing, and really looking forward to engaging with you as the commission continues to move forward and as we set up our working group. So I appreciate that. Next, I want to bring our second panelist, Dr. Kimberlyn Larry, who is Senior Policy Advisor on the White House Domestic Policy Council, where she works with the Racial Justice and Equity team to implement President Biden's equity agenda. Dr. Larry will share her perspectives on how the Domestic Policy Council interacts with this work and its alignment with the goals of the commission. Please welcome Dr. Larry. Dr. Larry, it's great to have you here. Thanks for being here.
Thank you so much. I am completely delighted to be part of this inaugural meeting, and I wish to acknowledge the groundbreaking leadership of Erica Moritsugu and Crystal Kha'i. I also want to thank and acknowledge the members of the commission for your leadership. Now, what I'll be doing is zooming out a little bit to talk both about the Executive Order 13985 and some of the way in which we have been implementing that executive order, and then also try to put that in the context of how we understand in the administration what a commitment to equity and advancing equity means. So I had the opportunity and the honor, really, to start working on this work at OMB as a senior equity scholar before moving over to the Domestic Policy Council. So I've had a chance to see both sides of the house, if you will, as this executive order has been implemented. And as you know, within hours of taking office, the president charged the whole of the federal government with putting racial justice and equity at the heart of its work. And I think what's really essential about the executive order is that it affirms that it is the duty and responsibility of federal government to serve the public, both effectively and equitably. And the executive order included a number of components. You've heard about one from my colleague Alandra about setting up the Equitable Data Working Group. But in some ways, another really two key elements of that executive order are the requirement for agencies to engage in equity assessments. That is, to evaluate whether key agency programs, and I would mention this is not all agency programs, but key agency programs, to evaluate whether they create or exacerbate barriers to equal participation for underserved communities. And it's worth noting that this is actually complex work to do. The executive order asks agencies to shine a spotlight on the things they haven't done so well. That is, the barriers, gaps, and obstructions that burden communities of color, LGBTQ plus people, people with disabilities, those in rural communities, communities facing persistent poverty and inequality, and to spotlight that work. And having spotlighted where those barriers exist in key programs, the second thing agencies were required to do was to identify actions for addressing those barriers, and also to include metrics and accountability systems to ensure that the agencies develop, all of our federal agencies, develop equitable outcomes in communities. That was the goal, not just to address equity in the agency, there's another executive order on diversity, equity, inclusion, and accessibility, but to look at how the agency was performing in its mission of delivering equitable outcomes to communities. Disaggregated data and data strategies are clearly critical to this. And Aa and NHPI communities have understood this truth for a very long time. And the limited data disaggregation of the federal government has too often erased the disparities that many in Asian American communities face. Data is also crucial for equity assessments, as Alandra mentioned, and data is absolutely essential for determining whether or not the mitigating actions agencies will implement will actually reduce barriers to equity. But let me zoom out a little bit further still to talk about systemic forms of injustice and how they're often anchored within systems in which exclusionary regulations may be baked into everyday administrative procedures and protocols. And while some policymaking, we can all appreciate, can result in unintended consequences, I think it's fair to say that systemic injustice can also reflect intentional human choices to use policies and regulations to discount or harm others. So the executive order recognizes that systemic inequities, including across the federal government, can also flourish in practices that might appear to be neutral on the surface. So, for example, programs that provide services for those in underserved communities might be weighted by higher levels of administrative burden. For example, complex, confusing, or repetitive requirements in order to access services, than other kinds of programs that are more likely to receive universal use. And these burdens particularly impact Aa and NHPI communities, especially for families that may have limited English proficiency, are experiencing poverty, or are first-generation Americans. And often we may not see these barriers. Some might say we choose not to see these barriers, but we may not see these barriers because they are so deeply embedded in systems as to be nearly invisible. So the executive order is aimed at, through these equity assessments, of trying to make these barriers more visible. And then not just relying on the agency to do that, but inviting agencies to work closely with stakeholder communities, including to learn about barriers to equity, but also in some cases to be part of the process of designing mitigating actions. And I think it's also worth noting that while systems contribute to systemic injustice, they also can be uniquely positioned, and the federal government is certainly uniquely positioned because of its scale and scope, to drive scaled change if the right mitigating actions are rolled out across the system. So in agencies over this last year, they have in fact mobilized swiftly to meet the considerable and rigorous timelines laid out in the executive order. And they did this in a couple of ways. I'll just say a couple of elements. They created agency equity teams, and they had guidance to include chief data and evaluation officers, frontline staff, and also, as possible, senior leaders. I mentioned that the executive order specifically calls on agencies to engage with advocates and with stakeholders and communities. And many agencies, in addition to the Office of Management and Budget, have launched requests for information, held listening sessions, challenge competitions, and a variety of stakeholder engagement initiatives. And then the agencies also had to begin to, in addition to that assessment, begin to think about, if given X barrier, what is Y action that will reduce it? Perhaps not right away, government takes time, but over time, and in a way that can be demonstrated over time to communities. Again, it's important to remember that this is a whole of government approach. And during this whole of government approach, we also recognize that agencies were in the position of learning. They're in different places in their journey around disaggregated data, different places in terms of their capacity to conduct equity assessments. And so in recognition of that, we try to create opportunities for agencies and their equity teams to learn from one another and to share best practices. And I would mention in that regard that there was a learning community that OMB launched for federal agencies, members of equity teams, that included well over 20 executive education style sessions and programs. Some were from fellow federal colleagues who were sharing best practices, and others were from those outside of government. One of our training sessions for federal employees was specifically on how to address the needs of Aaa and NHPI communities. And I'm proud to say, on behalf of the Domestic Policy Council and Ambassador Rice, who directs the implementation of this executive order, that on January 20th, we reached a major milestone. After conducting equity assessments over the course of 2021, over 90 federal agencies have now submitted equity action plans. And we are busy reading each and every one of those plans. I'll say more about that as we go on. But I just wanted to share a few examples of how the administration's actions, including but not limited to the executive order on equity, are changing the way in which the executive branch and its agencies conduct business. So the administration, as you know, has prioritized equitable spending in the American Rescue Plan and other pandemic relief efforts to ensure that federal help is getting to those who need it most. For example, nearly 5 million Americans gained health insurance with subsidies provided by the American Rescue Plan. Approximately 66% of Black uninsured adults may now have access to zero premium plans, and 76% can find a low premium plan. And among Hispanic and Latino uninsured adults, 69% may have access to a zero premium plan, and 80% may now be able to find a low premium plan. And the American Rescue Plan has also lowered or eliminated health insurance premiums for millions of lower and middle income families enrolled in health insurance marketplaces, including 197,000 uninsured Aa and NHPI community members. The ARP was projected to reduce poverty by nearly 22% in Aa and NHPI communities through increases in the value of supplemental nutrition assistance program benefits, through direct relief payments, and through extension of unemployment insurance extensions. And the expansion of the child tax credit has kept 3.6 million children from poverty. And that program cut the poverty rate among Black children by 22%, Hispanic Latino children by 28.9%, and AAPI children by 23.4%. Now, these These achievements and presidential commitments, I think it's important to recognize, are not the end or the culmination of this work, and nor are the submission of these agency equity plans. In fact, the significance of them is that they position the federal government to drive towards equity for years to come. And we've certainly recognized in our work with agencies that rooting out systemic racism isn't a one-year project. It's a sustained commitment. And our ambition is for equitable policymaking practices to outlast this administration, to become a part of the DNA of how the federal government does its business. And that's why one of the major focal points of our first year in office has been to build capacity within government for equity work, to create, as we say, new muscle for agencies to identify and respond to where their programs and policies perpetuate unfair outcomes. And second, having built this equity muscle in this second year and going forward, we'll be able to flex those muscles in new ways, including through implementing the bipartisan infrastructure law. And the infrastructure law is a once-in-a-generation investment in our infrastructure and economic competitiveness. It's also an unprecedented opportunity to embed equity in how those dollars are spent and ensure that the federal dollars redress the harms of discriminatory development and divestment in communities of color in the past. This includes addressing the harmful infrastructure projects that cut predominantly and historically Asian American neighborhoods off from opportunity, and ensuring that those communities benefit equally from new funding opportunities and job creation. My colleagues and I are, as I mentioned, quite busy right now reading the 90 agency equity plans that have come in. We are analyzing those plans, and we are looking forward to an opportunity to share key lessons learned after our analysis is complete. Thank you very much for the opportunity to address you and to share what I think has been certainly one of the most personally meaningful professional experiences of my career, to be a part of the implementation of this executive order.
Dr. Leary, thank you so much for giving so much detail about everything that's happening within the Domestic Policy Council. And just for our commission to know, when OMB does something, it's actually really important in the U.S. government because everybody pays attention to what the Office of Management and Budget wants. So the fact that you come from there to the DPC is a big deal. And the work you were doing there is super important, but also the work you're doing at DPC. And thank you for emphasizing how this is going to become long-lasting across government, the way y'all are approaching it. So I know we'll have a lot more questions for you. I don't know if we're going to get to them all today, but I really hope we'll get to continue to engage with you. We've got one more speaker before we go into questions. So I'm going to go ahead and introduce Dr. Karthik Ramakrishnan, who is the founder and co-director of AAPI Data and a professor of public policy at the Center for Social Innovation at the University of California, Riverside. He also serves as the executive director of California 100, a statewide initiative focused on building a vision and strategy for California's next century that is innovative, sustainable, and equitable. Dr. Ramakrishnan will share more about his work on data disaggregation and recommendations for how public-private partnerships and government can do better to capture data on Aaa and Hpi populations. Karthik, I'm going to call you Karthik because I know you, and I really appreciate your coming on, and thank you for all the work that you have been doing. You've been out there talking about data disaggregation and doing it for a very long time, and we're grateful to have you here.
Well, I'm going to call you Commissioner Shah. Thank you so much, Commissioner Shah, for this opportunity, and Happy Lunar New Year, everyone. Just so honored to be following these amazing, high-powered speakers and to share space with you all, Commission. I'm also chair of the California Commission on APIA Affairs, and I see that one of our commissioners is also on your body, so we look forward to working with you in multiple ways. Data disaggregation and data equity have been key priorities to advance Aaa and NHPI community needs for decades. Without detailed, accurate, and timely data, our communities are rendered invisible and misunderstood. And these misleading narratives end up harming our communities in many ways, including insufficient attention, lack of public resources, and lack of philanthropic investments. Indeed, as my colleagues Jennifer Lee, Janelle Wong, and I have written, data disaggregation is a civil rights issue for Aaa and NHPI communities, and it's no surprise that whenever there is talk about data disaggregation or data equity more broadly, our communities pay attention. Next slide, please. As the founder and now co-director of API Data, we have refined our approach over time because we realize that data do not speak for themselves. Interpretation matters, narrative matters. And the approach we take is something that we cooked up at the Center for Social Innovation and is now part of API Data's work. We call it simply DNA, data, narrative, and action. Without systematic data, stakeholders and decision makers do not take communities seriously. But without narrative, our needs and interests are not remembered, they're not memorable, they're not sticky, and so it's important to have both data and narrative together. And ultimately, data is not important just for its own sake, but to inform and inspire action, either action by decision makers in government agencies and philanthropy, but also action by community organizations. Next slide, please. Say a little bit about our team. In addition to Professor Janelle Wong, who's my co-director, I'm honored to be in this work with others like Professors Jennifer Lee, Professor Nines Ponce and Sarah Sadwani, and then Ryan Vin, who just recently joined us as our Data and Community Partnership Specialist. We are expanding our team with a managing director and an API Data fellow with the National Council of Asian Pacific Americans coming online very soon. Next slide. We'll just say a little bit about some upcoming projects that we're doing, and not only by ourselves, but in collaboration with others. And we would love to have the Commission informed and engaged in these opportunities. Next slide. First, we have a series of monthly strategy calls of our Data Equity Strategy Group. And these include leaders in community-based organizations, government agencies, philanthropy, as well as researchers in academia, as well as other types of research centers. This is a focus on strategy to, again, advance that DNA model on data, narrative, and action. We would love to have you be part of these meetings. Coming up in March, we are doing our one-year anniversary survey, re-upping it with SurveyMonkey, who is now called Momentive, on American experiences with discrimination. This is a survey not only of Asian Americans and NHPIs, but also comparison samples of white, Black, and Latino communities to see how these communities are faring 1 year after the killings in Atlanta. We also are planning a refresh of our state electorate fact sheets with API Vote. In May, we will be publishing a data equity report, which includes planned interviews with leaders in government agencies at the federal level, and we hope to have that data and report to be able to share with you at our National Data Equity Summit that we're doing in collaboration with NCAPA and hopefully federal agencies as well in late May. At this event, we're also hoping to release a State of the APIs report nationally as well as in California. Finally, in July, we plan to release an Asian American voter survey. It's a survey of registered voters with API Vote. So we have a busy 6 months ahead, and we'd love to have your engagement in whatever ways are meaningful to you. Next slide. To say a little bit about our approach to data is not just about thinking about narratives, but to make data as easy to access as possible. Parenthetically, I'll say that while there have been improvements in federal data websites, part of the way that we get attention is that we get people access to the information that they need really quickly. And it's not always easy to get this, for example, on data.census.gov. Next slide. In addition to the Community Facts tool, which I just featured, we also have a Quick Stats tool. And these are very simply sortable tables. We have worked with community partners over the years in terms of what are the key indicators they look for when trying to fill out grant applications, right? Or trying to talk to reporters. And so a lot of people have found this tool helpful. Next slide, please. We are beta testing a new tool which will make it even easier for people to select their level of geography, the kind of community that they want to choose to be able to compare not only across detailed ethnicities, but also to compare it to top-line racial groups. So this is something, as I said, that is in beta testing. If you're interested, you can email ryan@aapidata.com, and you can be part of our beta testing group. Next slide. Finally, we've also found that pictures, as they say, pictures worth 1,000 words. So it's not just about the data that you put out, but the kind of visuals you put out that make it easy for communities and various stakeholders to understand and grasp an issue. One factoid that I'm so proud that we moved quickly to create, and this was after President Obama had announced the expansion of the DAPA program and deferred action for the parents of Americans, is this factoid of 1 of every 7 Asian immigrants is undocumented. Now, that number has changed since then, but that was a way for people to think beyond just the millions of individuals that might be affected by that issue, and to think just really powerfully about how in any room, if you have Asian immigrants in that room, that 1 out of every 7 people is likely undocumented. Next slide. Finally, we've also worked with groups like APIP. This is Asian Americans, Pacific Islanders in Philanthropy. We did this during Census 2020. We believe that data not only should be accessible, we believe that data can be beautiful. And our community partners used these data points to target, to do more effective targeting when it came to census outreach. Next slide. And you can still see this today, for example, if you go to censusmaps.apidata.com, and we're hoping to get disaggregated data from the Census Bureau as soon as possible. Now, I'll take the next step to talk about some important features of Aaa and NHPI communities and why it's so important to disaggregate. One, when we think about the changing nature of our community, we have to recognize that our community is changing pretty dramatically with respect to detailed origin. So the South Asian population is growing rapidly, and this notion of East Asian as the default Asian category, it did not apply in 2000, and it is less and less true as the years go on. So it's really important for people to update their mindsets in terms of who Asian Americans and Pacific Islanders are. Next slide. It is also important to look at the vast variation in any particular outcome across communities. So on outcome after outcome, you will detect a pattern where, in fact, you find Southeast Asian refugee populations doing much, much worse than the most prosperous Asian American groups, but often also doing on par or even worse than other communities of color in the United States. Next slide. Now, it's not just about disaggregating the Asian category. It is also important to disaggregate the Native Hawaiian and Pacific Islander category, which, as a reminder, commissioners, is a separate racial group in the census and according to OMB. Next slide. Language proficiency also matters in terms of wide variation within our communities, and you can go to our website to see the various ways in which you see differences across communities. Other key facts you should know about Asian American populations and Pacific Islanders in some future slides. One, Asian Americans are an important part of the immigrant vote. So if you talk about immigrant voters and you don't mention Asian Americans, you're engaging in either scholarly malpractice or journalism malpractice, right? And too often we see stories when reporters talk about the immigrant vote and don't talk at all about Asian American voters. Next slide. It is also important to talk about the rapid growth of our community. My apologies, I had a slight change in order of the slides from how I saw it. So taking a step back, when you look at the Census Bureau and what the Census Bureau reveals, what it reveals are that Asian Americans and Pacific Islanders are among the fastest growing populations in the United States. This was true from 2000 to 2010. This is also true from 2010 to 2020. Our communities are eagerly waiting data on particular populations to see how those population numbers fare for particular groups. So, for example, looking at American Community Survey data, we know that the Bangladeshi population is among the fastest growing immigrant groups in the country, period, and is likely going to be the fastest, if not one of the fastest, detailed origin groups in terms of population growth between 2010 and 2020. Next slide, please. Next slide, please. apologies here. It seems like there was a slight change in the order. Next slide, please. Okay, so in terms of, my apologies, folks, there's been some slight change in the order, but I'll just make do as I can. Thinking about Asian American voters, there is a question about, amidst all this diversity, is there such a thing as an NHPI agenda? This is where detailed data collections are important. Instead of just having a simple yes or no question that is not informed by data, we can look at over a decade of survey research with detailed, disaggregated data collection to identify the conditions under which our communities are in solidarity. And the remarkable thing about our community when you look at public opinion data is that despite all of this diversity, by socioeconomic status, by religion, by income, by language proficiency, you see so much commonality in terms of opinion on a variety of policy issues. I'll save some of this for the Q&A, but these can be broadly grouped under the themes of inclusion, protection, opportunity, as well as education. And on education, it may not be the kinds of issues that people might think. Affirmative action is not a high salience issue from what we see in our public opinion data. And in fact, the community is fairly supportive of affirmative action when it comes to higher education. What they do care about is education access. They care about the quality of public education, and they care about the affordability of education, including college debt. Next slide, please. Next slide, please. Next slide, please. So let's keep going. Another slide. Okay, so finally, I'll talk a bit about Asian American and Pacific Islander experiences with hate crimes. So if you look at API experiences with hate crimes, what we found in 2020, and we're going to be 2021, and we're going to be repeating this in a March 2022 survey report, we found that about a quarter of Asian American and Native Hawaiian Pacific Islanders said that they have ever experienced hate crimes and hate incidents, and that since the pandemic began, about 1 out of every 5. So if you combine the 12, you can't just add those numbers. If you look at those who either experienced it in 2021 or in 2020, 18% said they had experienced it since the onset of the pandemic. Next slide. Next slide. And if you compare this across racial groups, while it is important to acknowledge the relatively high level of hate crimes and hate incidents among Asian Americans and also among Pacific Islanders, it is also important to acknowledge the high level of hate crimes and hate incidents experienced by multiracials in the United States and Black people in the United States as well. Next slide. We also asked about everyday acts of discrimination, and we find that Asian Americans, followed by Pacific Islanders and Latinos, have among the highest rates to those who answer the question, have people asked you where you're from, assuming you're not from the United States? Next slide. At the same time, there are other stereotypes that hurt other communities of color even more so than Asian Americans. So for example, Black people and Pacific Islanders report higher rates of these stereotypes of people acting as if they were afraid of you. Next slide. And in terms of being unfairly stopped and searched by police, we find that Black people and Pacific Islanders have higher rates of incidents than Asian Americans. Next slide. It's also important to look at the data to correct some of the selective inferences we might have based on reports to hotlines or to federal authorities. So while hate crimes and hate incidents among women are important, it is also important to recognize that men in our survey also report high incidents of hate crimes. Native-born people, as well as younger Asian Americans and Pacific Islanders. So this is not just something that affects elderly Asian immigrant women, as some of the social media memes and videos might suggest. Next slide. And there are important implications for policy because these communities are often uncomfortable reporting hate crimes and hate incidents to authorities. Next slide. Finally, I'll just say something about data equity. I'm happy to cover this more in the Q&A, as well as later with you commissioners, as well as with other federal agencies. We've been working with the National Council of Asian Pacific Americans, which is a coalition of dozens of Asian American and NHPI groups throughout the country. And these are some of the recommendations that flow out of those discussions. First, we would like to define data equity as the inclusion and incorporation of community expertise and research expertise, and also to ensure that there is equity in all stages and aspects of data research, including design and development, collection, compilation, and processing, as well as analysis, dissemination, and preservation of data. Next slide. I'll go through the next 3 slides very quickly.
And Karthik, sorry, I'm going to rush you because we've got our 2 next speakers ready to go, and they've got limited time, so sorry.
Yep, no problem. I'll do it in 1 minute. These are the main points we have here, and you can review them at your convenience. Next slide, please. And this is really building on the remarks that Dr. Nelson said. It's really exciting to see the work of the Equitable Data Working Group, and our communities, including our researchers and community leaders, are ready to partner to strengthen the work. So, for example, about the disaggregated data repository, there's so much interest in making sure that these repositories are user-friendly and community-friendly. Next slide. The creation of pilot programs, we're really glad to hear about the proof of concept projects that Dr. Nelson mentioned, and it would be great for our communities to be in partnership as much as possible to help expand the scope of those projects with an intentional view to improving the lived experiences of Asian American, Native Hawaiian, and Pacific Islander populations. Finally, in the last slide, in terms of inclusion, not only including our community leaders and scientific experts, but to think about institutionalizing our role similar to the Census Scientific Advisory Committee and the Census National Advisory Committee. I'm honored to serve on the Census NAC along with a few other Asian American and NHPI members, and that would be a great model to follow for the Equitable Data Working Group in terms of recommendations for other federal agencies to follow what the Census Bureau has done. Thank you so much for your time.
Dr. Ramakrishnan, thank you so much. Sorry to our commissioners, we will not be able to take questions because we are about 7 minutes in and want to make sure that we can ensure Dr. Lisa Pino and Kristen Clark have a chance to present. And again, just to keep in mind as we keep moving forward here, Dr. Ramakrishnan offered a lot of information, and there's really great information here. So we should think about what the subcommittee on data disaggregation should think about inviting him both to present, but also potentially to help in the subcommittee as we look through data disaggregation, because he has some great recommendations in there too. So just to keep that in mind as a commission, so no worries. But again, we will have time to invite people and to do more. So please don't see this as the only opportunity. So with that, I'm going to go ahead and move on to our next panel discussion focused on language access, which is another major topic for Aaa and Hpi communities, and it has been for decades. So in this panel, we're going to learn about how language access works in context of the federal government and what is expected of federal agencies and federally funded entities. I have the pleasure of introducing you to our first panelist. You've already heard from her this morning, Lisa Pino, who is the director of HHS's Office of Civil Rights. Ms. Pino formerly served as the New York State Department of Health's Executive Deputy Commissioner, the agency's second highest executive. And today she's going to share more about what HHS OCR does to address language access issues across HHS. So Ms. Pino, thank you for joining us, and really apologies for our delay, but really great to have you again.
Thank you so much, Sonal. No apology needed. It's wonderful to hear that critical information about data. So I'll do my best to keep it concise and stay on time. But hello, everyone. Welcome again. I'm Lisa Pino, Director of the HHS Office of Civil Rights. We are thrilled to be able to focus on the importance of language access for the Aaa and Hpi community. Next slide, please. So what does the HHS Office for Civil Rights do? Well, we were founded in 1965, and our responsibilities include a range of activities. For one, we investigate civil rights complaints from the public, of course. So, for instance, last year, we received more than 48,000 civil rights complaints alone. We also conduct compliance reviews. If we hear from stakeholders across the community of issues of concern, we we go on the ground and we make sure that civil rights protections are in compliance. We also secure voluntary corrective actions on settlements with covered entities and other parties. We provide technical assistance to help resolve civil rights complaints issues as quickly as possible. And we conduct regular public outreach. And of course, we issue policy. So whether it's regulatory or guidance, we do that on a frequent basis. Next slide. From a technical perspective, how do we define limited English proficiency? Well, the Census Bureau officially defines it as those who speak a language other than English at home and who speak English less than very well. Next slide, please. So what is the intersection of the LEP proficiency in the Aaa and Hpi communities? Well, according to the American Community Survey from over 10 years ago in 2012, 35% of the Aaa and NHPI population is limited English proficient. That's pretty high. 19% speak English well, 12% speak English not well, 4% do not speak English at all. That's why it's that much more important, our role as the Office of Civil Rights, to work with covered entities to make sure that we're amplifying language access as much as possible. Next slide, please. Why are language barriers so important in terms of the issue of health disparities? Well, the only way that we're going to achieve true quality health care for all underserved communities is by eroding these barriers and making sure that language and language access does not at all interfere with quality health care. We know surveys and research shows that language barriers are associated with lower quality of care, poor clinical outcomes, longer hospital stays, and higher rates of hospital readmissions. That's why it is so important that language access is adhered to by federally funded entities. Next slide. Specifically, what health disparities and discrimination are faced by the Aaa and NHPI populations? Well, a study released last year by the CDC found significant racial disparities in COVID-19 incidence among this community. For example, the incidence rate of COVID-19 among Native Hawaiian Pacific Islander persons in the sample was more than twice the rate of persons. We also know that media reports since the pandemic ensued indicates how healthcare workers of Asian descent have faced discrimination and harassment. These are only one of two ways that we know that the community is being targeted and not being treated fairly under discrimination and civil rights laws. Next slide. National origin discrimination and language access. Our work is to make sure that everyone is treated equally. People should not be treated differently. Neither should they receive delayed or denied treatment because they are limited English proficient. And the failure of a recipient of HHS funds to provide language assistance services to individuals with LAP may constitute national origin discrimination. And that's where our Office of Civil Rights comes in. Whether it's technical assistance or working with a compliance review, our work is to make sure that this does not occur. Next slide. Our work, as shared before, is to remove those unlawful barriers to HHS conducted and funded programs. Our mission, ultimately, as a law enforcement agency, we do the work of investigating complaints, making sure that compliance is whole, issuing policy. Most of all, we have to protect recipients of HHS federally funded financial assistance from discrimination on any basis, whether of race, color, national origin, disability, age, sex, or religion. Next slide. Our legal authorities for this work of civil rights prohibitions against race, color, national origin discrimination, they lie within Title VI of the Civil Rights Act of 1964, and of course, Section 57 of the Affordable Care Act of the ACA. Both of these laws require recipients of federal financial assistance to take reasonable steps to ensure meaningful access to their programs by persons with LEP proficiency, and OCR has developed guidance to help recipients of HHS funds covered entities comply with this obligation. Next slide. Examples of how we take action. One instance most recently in New York at the start of the pandemic, administrators of a hospital allowed only certified interpreters to assist medical professionals triaging and treating patients with LEP. This made it impossible for hospital staff to keep up with the flow of patients, especially as finding quality healthcare workers was scarce. but OCR worked with a physician who was greatly relieved to learn that interpreters need only be qualified. Therefore, that allowed the hospital to use many more bilingual medical students to resolve the backlog and not be restricted only to certified interpreters. Next slide. You can find on our website on hhs.gov under success stories involving persons with limited English proficiency, a multitude of success stories, whether Colorado, California, Arizona, Mississippi. There you can find how, for instance, in Alameda County Medical Center, we work with the medical center to figure out the best way to amplify language access. For instance, the medical center trained its staff in Title VI compliance and oral written communication needs assessment for LAP patients. It issued medical cards to indicate a patient's primary language. It updated its registration area signage to include the 5 most commonly used language in its service area. The hospital also posted signage indicating that interpreter services are available free of charge, and contacted with video and telephone interpreter services so that immigrants visiting the hospital could get language assistance readily available. Next slide. Civil Rights Division, action through collaboration. We have other sister agencies within HHS that we work with on a regular basis, for instance, our Office of Minority Health. We also are fully engaged on our Interdepartmental Health Equity Collaborative, and we readily work on emergency preparedness. So our Office of OCR issues guidance to emergency officials and emergency responders to address needs of at-risk populations, such as individuals with LAP, work that is that much more important under the pandemic. Next slide, please. Being proactive through public education. This demonstrates the many ways that we engage with communities, whether it's providing virtual outreach opportunities, collaborating with federal partners such as the Department of Justice, and conducting interagency and interagency activities, specifically on health equity, for instance. Next slide. Well, we know, especially now, as the Aaa and Hpi community unfortunately has been targeted, that listening that much more is so critical right now. And in the last couple of years, in FY20 and FY21, despite working remotely on COVID, we have participated in more than 30 civil rights outreach events. We know that it is that much more important to work with stakeholder organizations, learn and listen, and adopt solutions for how we can further improve language access and LAP across the country. Some of the organizations we've recently worked with include the Association of Asian Pacific Community Health Organizations, Asian Pacific Islander American Health Forum, Asian Americans Advancing Justice, and the National Asian Pacific Bar Association. Next slide. This indicates different examples of policy guidance that we have issued. So most recently in December, for instance, we issued Title VI Bulletin on federal legal standards prohibiting race, color, and national origin discrimination in COVID-19 vaccination programs. This work is that much more important as we know that the pandemic has only sadly magnified racial and health disparities. Next slide. Other ways that we make an impact is that we conduct Title VI trainings on civil rights for the medical school's training curriculum. So we work with the Association of American Medical Colleges, whose membership includes 172 accredited U.S. and Canadian medical schools. Last year, we trained over 1,000 students on the importance of language access and national origin discrimination. Next slide. We also are heavily involved in implementing Executive Order 13166 to improve access to services for persons with LAP. The goals for each federal agency include improving access to federally funded programs and activities by persons who have LAP, and to implement a system by which persons with LAP can meaningfully access the agency's services.